When you work with Daniels Health, we develop a tailored healthcare waste management plan with an installation process customized to meet your facility's needs. Here's how it works. Before any work is started, our team will identify themselves, and the project lead will work with the appropriate on-site manager to determine any specific needs, special instructions, and unique cases, such as rooms not to be entered during the install. Once all introductions have been made, the work begins in earnest. Before entering a room, the Daniels Health installer will sanitize their hands and don all required PPE for patient care rooms and procedural areas. The Daniels Health installer will knock and gain permission from the patient to enter occupied rooms. The installer will start by opening the existing vendor cabinet and removing the cabinet within before taking the cabinet off the wall. The installer then determines the best location for mounting the new Sharps container. Sharps container locations must meet NIOSH container height guidelines while providing unobstructed access for the waste generator. Wherever possible, the installer will seek to reuse existing drill holes. Next, the installer levels the wall bracket and marks holes for mounting it against the wall. To mount the locking bracket, the installer will create pilot holes to drill wall anchors into the wall. After installing the wall anchors and affixing the locking wall bracket to the wall using appropriate wall screws, the installer caps each hole to seal off screw holes for easy sanitizing. The installer then mounts the Daniels SharpSmart container onto the wall bracket. If your facility is using locking wall brackets, the installer will lock the container to the wall at this time. A how-to decal will be applied to the container with a scannable QR code that delivers staff education and information on the new system. Before leaving the room, the installer will thoroughly clean up the area, including wiping down walls. As a final step, the installer will thank the patient for allowing the interruption. This process is then repeated across all required rooms until the installation is complete. For more details on the installation process, visit our website